Hey everyone, you're watching a sample that's coming from our Home Health Marketing Bootcamp. That's right, over 7 hours of amazing content that's going to be able to help you guys learn what steps you need to take in order to become that preferred provider. So just want to let you guys know, please make sure you stop by 10xpatientreferrals.com and sign up for this bootcamp. It is only available for a limited time at this moment. Okay, everyone, so now we are in the presentation portion of this whole sales process. I hope that you're starting to really assess your agency as we are going through here right now. Every step of these things that we're sharing with you guys in the whole sales process is an important thing. You must make sure that you're able to stand out. You must make sure that you're following through with these things, because if you're skipping steps, you're not going to be able to assess yourself, and you really are not going to start seeing success in your marketing. These are the differentiators of what great marketers, what great agencies are doing compared to other companies that are not. And we're just talking marketing here. Of course, in the whole other thing, the whole medical, the whole service providing thing, that's a complete different aspect. And we can touch base with those in other future videos. But really here in this bootcamp that we're sharing with you guys, it's all about marketing. It's all about sales. It's all about getting people to know who you are. Okay, so now we are in the presentation section. That's right, the presentation section. This right here, really the truth is this, it's not really the most important part of the whole sales process. The sales process is the beginning towards the end. This part right here, you can mess up, you can do a better job, that's great. But really the truth is, the next step is going to be most important. But if you skip this step, if you don't even want to pay attention to this, it's also going to be a make or break it for your company. So presentation is where you build value, right? In the presentation is where you have to build value. This is where you start building them trust for them to pay attention about your company, right? I told you guys this in the beginning, that for the number one reason why agencies are not getting referrals is because they are not known. You're not known. Nobody knows you exist. Just because you walked in one day, that doesn't mean that they know you. But here's the fun part, guys. The truth is, you need to go to 3 different stages. They must first know you, they must like you, and then they must trust you to be able to give you a referral. And then when they give you the referral, can they continuously trust you to take more of their referrals and take care of their patients? So in the presentation phase, we're building trust, we're building value. Now, remember when we started talking about the qualifying, the qualifying process, the qualifying before we do presentation, we talked about what type of questions to ask about the good and the bad of the agencies that they're currently working with. Now, we don't want, when somebody tells us, hey, tell me about your company, we don't want to say, hey, my name is Michael with ABC Home Health. We provide this, that, these things right here. The typical spiel. We provide quality care. We provide, we have great services. We have an on-call team. All those things are great and all, but never jump into that hoop of trying to push your product right away. In the qualifying phase, you must qualify them and figure out what their choices are. Now, there's these 2 questions that I asked a lot, right? Do you guys remember the 2 questions? Can you tell me the questions right now, verbatim or within close proximity of it? I will tell you guys more likely not. You may not remember that questions, or hopefully you wrote it down. But if you didn't write it down, hopefully you know it by now. But more likely you don't. And this is why, when we do sales training, it's important that you continuously have training available. And that's why we have our 10xpatientreferrals.com website, because it allows you to have multiple abilities to keep on going back and train yourself on where you may have some deficiencies on. But let me go ahead and ask those 2 questions again, right? These are the 2 questions. Excuse me, Mr. Referral Source, right? I'm going to say this. I'm going to say, what made you choose to work with agencies in the past? Or what are 3 things that made you choose to work with agencies in the past? Once again, what I'm finding out is their buying criteria. And at the very same time as I'm plugging the part of saying that those agencies they're working with are going to be in the past. Because why? I'm here right now. Now I'm going to use that buying criteria in my presentation, because now I can talk about what works for them. And then what's that second question? And no, the answer, that question is not, what are the agencies you're working with doing wrong? It's not that way, right? We can ask the same question, but in a different way. If the agencies you're working with right now can improve on something to provide better care for your patients and to take great care of you, what would those be? Right there, that's the question. It's the same type of answer that we're going to get, but at the very same time, it's not us being negative or not putting the blame on that referral source saying that they made the mistake of choosing the agency they're working with. Because if those agencies are doing bad things, wrong things, then you're literally saying you're doing wrong things, to that referral source you're trying to talk to. So we don't want to be able to imply that at all, okay? So that's a no-no. So you want to pay attention. Once again, let's go with the same question all over again. If there are 3 things that those agencies can improve upon, what would those be to provide better care for your patients and provide great care and services to you? Once again, you guys are seeing that I'm changing the words a little bit, but it's all within the same context of the whole thing. By you doing this, you can qualify yourself, you can qualify them and figure out how your company, you as a marketer, is a good fit to work with their agency, to be able to work with their patients. Most marketers are not good at presentations. And we hear this a lot. A lot of owners, a lot of marketers are gonna tell us, like, Michael, I don't know what to present. I don't know how to present. I don't know how to control the room. Hey, guess what, guys? At one point in my life, I wasn't good at presentation. And the truth is, I'm still not. But guess what? I'm always doing something to be able to improve myself. I used to be one of those guys in high school, right? That when I was asked to do a speech to go in front of the class, my legs just start shaking uncontrollably. I get so nervous, I start stuttering. But what I did was, this was a weakness of mine, and so I made sure to double down on the weakness to try to learn how to improve it. I still have moments of stuttering. Heck, while I'm talking to you guys right now, while you're watching this video, I stuttered a couple times. I mumbled a couple times, but I just keep plowing through because my goal is to share information with you guys that's going to be able to work. And if you guys are probably noticed right now, I'm not gonna edit this video as much because I'm not gonna just jump stop from one area to the other. I'm not gonna do that. And the reason for that is because I want to show you guys that, listen, it's about the quality of information, the great product you're trying to offer, the solutions you're trying to provide for these referral sources that matters the most. And if you're so worried about how you present, if you might stutter, you might have an accent or whatsoever, guess what? I have that. I have an accent. I stutter at times. But I'm here presenting to you guys right now. I go in front of physicians. Hey, listen, I'm a nurse, you're a physician. You're on top of me, fine, in the whole order of things because you have a better education than me. But my mindset is me knowing that I have a service to provide your patients that is valuable, that they need me, that you as a referral source, you need me. You need my company because we're all on equal grounds here. We want to provide great care for our patients. So having that right mindset is such an important thing for you guys to be able to have. Now, other than this boot camp, it's going to be like 7 hours worth of training. This is what we do when we have our live boot camps, when we're having it all over the place. We're going to be in California. We're going to be all over Texas, Dallas, Houston, San Antonio. We're going to be in Florida, Orlando, Tampa, Miami. We're going to be in Chicago. We're going to be in Indiana. We're going to be in Ohio, Columbus, and Cleveland. Pennsylvania, we're going to be there. Both Philadelphia, right? We're going to be in those cities, in those states. We're sharing that information with you guys right now, but here right now, you're able to absorb it and reabsorb it continuously. Brought to you by our partners at homecareansweringservice.com and medicationreminderprogram.com. So medicationreminder.com, what they do is they can actually call your patients twice a day to remind them to take their medications. This lessens the chance of them being readmitted to the hospital. At the very same time, it provides value. It lets you show your referral sources that you are different, that you want to provide more services for your patients. It works amazingly for home care, especially with home health agencies. So look into this. It's a great thing for you to add for your company. They have 3 different plans, but later on, we're going to share with you guys a way to be able to save even more. The next one, homecareansweringservice.com. Listen, at nighttime, when you get a call from a patient or maybe even potential referral source on the weekends, sometimes you're not able to answer the call right away. At the very same time as you can save money, instead of hiring somebody to do your call answering, you can have homecareansweringservice.com handle this for you guys. At a low basic plan of $39 a month, they will handle your calls, especially in the weekends, especially at nighttime. You may have a manager on duty who's in charge of that phone, but at the very same time, at nighttime, they may not be able to answer the phones for you. So sometimes when a patient calls at night, a family member, if you miss that call, they may end up in the hospital or you may lose that potential referral. Now, don't forget, we have our live marketing bootcamp events happening all over the United States, but we have now our online marketing bootcamp available, so make sure you take advantage of that. Go to 10xpatientreferrals.com and check them out. So these are some of the cities that we're holding a lot of our events. We rescheduled them because of the whole COVID scare. Please make sure that you pay attention. The dates may change at this very moment, but please check with us. Now, here is how you can save some time. So at 10xpatientreferrals.com, we have an online learning platform, teaches you everything about marketing. Okay, so we have 3 different packages. As you guys can see, if you guys choose the gold plan or the platinum plan, you're going to be able to get some free service from home care answering service as well as medication reminder program. But if you just choose the silver plan, it's still great. You're still going to get 25% off the medication reminder program or 25% off on the answering service. So please, 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 please let us know how we can actually help you. This is Michael with Home Health Success Academy. Always understand, marketing is easy when you know what you're doing.